Hello, 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 friends. I'm your host, Dr. Bryan Laskin of the Patient First Podcast. I'm so happy that you're here. And again, just want to thank you for showing up, learning more about dentistry, and being engaged in our dental community. It's been so much fun. I've been doing this for quite a while now, and it's just fun to see how this is really taking off. And I love all your comments. So this one will be a little, hopefully, a little educational for everybody listening today. We're taking a simple topic and breaking it down in a way that hopefully makes is educational for everyone. And the topic that we have today is how long should we wait to fill a cavity? So, what is a cavity? How long should we wait? And kind of what are the sequelae that we want to avoid? Right now, if you're a patient and your dentist is asking, he says to you, "Oh, you have a cavity. We need to do a filling." Right? I'm going to be educating you hopefully on the dentist perspective of cavities. If you're a dentist, I want to hopefully give you some new technology, some new ideas around where we can be more proactive in stopping this infectious process. And yes, my friends, yes, as we all dentists know, cavities are an infectious process. What does that mean? It means that it's caused by a bacteria, in particular Streptococcus mutans, doesn't matter, but it's a bacteria that that has infected your tooth, and when it eats food, it causes acid to form that demineralizes your tooth structure and basically eats away at your tooth, causing dental caries, or commonly called a cavity because it's a cavitation in the tooth. Now, what does that mean? That means that this is a infectious process but caused by bacteria. And the bigger the cavity, the more cavity bugs, the more bacteria, which means it can spread. So this, if not taken care of, can spread from one tooth to the adjacent tooth to additional teeth. And every dentist knows that when you see somebody's mouth where there's just cavities all over the place, the first thing we need to do is get the infection under control. We need to get rid of as much of this bacteria that we can by removing the cavities and doing some type of filling or some type of restorative process to try to slow the infection down so we can contain it. Now, that's when things have gone for too long. But today, I'm going to talk a little bit about like what if you have a cavity? What does that mean, and should you take care of it? Well, you definitely want to take care of it before it goes for too long. What does that mean? Well, it's like kind of like asking, when should you replace your tires, right? We all know that there's tires that get thinner and thinner, and then you look at it and go, well, when is this going to pop? And we don't know, right? It can become problematic. Depends on many factors, as do cavities, what you eat, the bacteria in your mouth, the amount of saliva in your mouth, whether there's a lot of different factors that go into to what when is long too long. But fundamentally, the deeper the cavity, the more likely you're to have problems. If you take a drill to a tooth, I just read this, the average cost over the lifespan of that tooth is going to be $6,000 between that first filling and additional fillings, and maybe a crown, maybe a root canal. But the bigger the cavity, the more likely to have more downstream complications. If it's a big cavity, it might not be able to be restored with a filling. You might need to have a crown, or the possibility of needing to have the filling redone or having the tooth covered by a crown goes up over time. If it goes too deep, it could actually involve the root of the tooth and require a root canal, or you could lose the tooth. So there's some massive, and then again, it could spread to additional teeth. So we don't want to wait long to fix cavities because it can have some negative consequences going forward. But we also don't want to intervene too early, because if we intervene too early, then we might be setting this tooth down the cascading pathway of having additional work done. Because every filling is not as good as the original equipment, so you can get a new cavity around there, and the process can repeat. However, there's some new technology, and actually did a webinar with an Upgrade Dental. So if you are a dentist and you want to learn more about what's new in dentistry, the best place is Upgrade Dental. Every month, I do a future of dentistry webinar with a new company doing some really cool things. We have our upgrade update where I talk about what's going on in the world and apply it to dentistry every single month. And then we have our new sprints, including endodontic sprints that are coming, uh, assisting sprints, and all sorts of things to learn about what's new in dentistry and how to leverage team technology and the clinical dentistry to grow your practice. But one of the people we had on recently was a product called Curodont that reverses early decay. And so I think now, for the first time, there's been some other products that kind of did this, but not fully reversed early decay. I think it's time that we can intervene with decay prior to it getting through the enamel, or even just if it's slightly past the enamel, things that we would normally watch before we can actually reverse. Uh, it's a product again called Curodont. So, this is an infectious process that we used to at best be able to stop by removing it and filling it, or hopefully maybe before it was, while it was still in the enamel of the tooth, we could try to remineralize it and stop the process. But now we actually have something that can reverse early decay. So it's changed the parameters of the simple question that every dentist listens going, oh, I know the answer to this question. How long should I wait to get a cavity filled? Well, it's different now. We can intervene earlier. We can reverse early decay. So it kind of changes when we intervene. And I don't know have all the answers here because this is new technology, but I would definitely check it out. Again, the product is called Curodont, and if you're a patient that it has some watch areas, or if you're a dentist that is used to watching areas of teeth, I would urge you to look into this, because I think if we can intervene early, reverse the decay, leveraging this technology, and we can save a lot of teeth from having to have fillings even done. But if you're a patient that's been told you have a cavity that needs to be filled, if I just did a podcast on second opinions. If you disagree with your dentist, or you have concerns, you can always get a second opinion, and oftentimes you can get those for little to no cost. Just ask around and make sure to get your a copy of your digital X-ray before you go, so that you can have the other dentist give you an opinion. But fundamentally, from what I've seen, there's very low percentage of times, I believe, that dentists are saying that you need to have a cavity filled that doesn't need to be filled. And if you wait too long, that's what I see more often, is people go, I'll wait. And then it gets to be a bigger issue, a root canal, or needing to have a crown, or deeper filling that's going to need attention sooner. So that's my summary, my recap of how long should you wait to get a cavity filled. A traditional cavity that is, through the enamel into dentin, get it sooner is better. But I would certainly recommend everybody who is watching these lesions to use a product like Curodont. I don't take anything from them. I think it's really cool technology, and I think that it's time that it's one of those things in dentistry that we've done for my entire career and before my career, is just looking at something going, should we fill this or not? Well, now there's an answer. If you have a question, we have a tool that can help reverse early decay that is worth trying out. So check it out. Let me know what you think. If you've tried it out and you've had good success, I'd love to hear from you. If you are patient and you have questions about if you should get cavity filled, certainly reach out for a second opinion. And just like always, I look forward to seeing you next week right here on the Patient First podcast, so we can break down what's going on in dentistry, how we can get patients the care that they need, and do it in a patient partnered way, as I mentioned on an earlier podcast too. Thank you very much, and look forward to seeing you next week.